Imagine you're in pain and your doctor tells you that your pain is all in your head and you should just have a better attitude, man. And well, frankly, that would kind of piss you off since your pain is sure as hell real to you. But before you march up and sock your doctor right in the nose to try and teach him a lesson about pain, you're wondering, well, would that even hurt since apparently pain is just an illusion and it's all in my head? Well, in this video, we're going to take a look at whether or not having a positive attitude can actually improve your health and reduce pain, or if that's just wishful thinking and you're getting hoaxed. So let's find out. Welcome to Health or Hoax, the show that empowers people to make informed choices about their own health by taking a critical look at research on popular healthcare claims. Everything in this show is meant to inspire critical thinking rather than pretending that we have the one and only valid perspective. We are healthcare students and we're looking for truth. We're trying to make things easier for you to understand if the fads, diets, and treatments that you're being sold are health or hoax. So here we go. First, we got to talk about what pain is and what it's not. So, what is pain? Is it a sensation? Is it a signal telling you something is wrong? Is it a protective mechanism? Is it reliable? Is it an emotion? Is it an illusion? Well, according to the Association for the Study of Pain, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. In less sciencey speak, pain is something we feel that we don't want to feel. This could come from a part of the body and be accompanied by an emotional response, like crying, swearing, sadness, anger, and the like. Or it could just be an entirely emotional experience, since pain can happen with just potential threats, where your brain expects danger, so it creates a feeling of pain, even though your body is currently unharmed. Watch out! Empathetic pain is real. Even just seeing another person hurt can cause us pain. Pain can happen with actual damage to your body, like a guy skateboarding who falls and racks himself on a pole, or you can experience pain by just watching someone else get hurt. Have you ever felt pain watching someone get hurt? Ask any guy who's watched a skateboarding fail video, and they'll tell you they actually feel real pain when some poor lad carelessly uses his reproductive organs like an airbag against a metal handrail. It actually hurts to watch. Pain is complicated and can be an amazing defense mechanism for the body. People who don't feel pain tend not to live as long since they can't anticipate and avoid danger as easily. On the other hand, some people feel more pain than it is appropriate, and it's no longer serving them the purpose of a warning system. It's like if your damn household security system had a glass break alarm that just went off every time someone sneezes, but unfortunately we forgot the code and we can't turn the damn thing off. This is often the case in chronic or long-lasting pain. According to clevelandclinic.org, chronic pain lasts for more than 6 months. It often persists after the tissues of the body have healed, and it can develop in the absence of any initial damage. So again, you're healed, you don't have damage, but you still feel pain. Why? I mean, what the hell, right? When I get a paper cut or break a bone, as soon as it's healed, the pain goes away. But what if it doesn't? There's nothing to heal, nothing to fix. What the hell can I do about it? How am I supposed to deal with pain that's not actually coming from tissue damage? This can make some people feel very helpless, and it doesn't feel good to have someone tell you that your pain is all in your brain. Side note, you should know that even though pain is created in the brain, it's still real. Even pain that can be triggered by injury, or it can be triggered by tissue damage, or as a warning system, or more psychological reasons, all of that pain is still real, and even though it's in the brain. Some doctors and alternative medicine practitioners dismiss the idea that a more positive attitude can help chronic pain or risk go away, because it would just be naive optimism. Like, right, if quote, real medicine hasn't helped, then how could just having a better attitude possibly help you? And that kind of makes sense, but that's the question of today's episode. Today we're looking at a systematic review by Hansen et al. 2017 called Can Positive Affect Attenuate Persistent Pain? State-of-the-Art and Clinical Implications. We're also going to pull from research that this particular study cited, and you can find all of our references in the show notes. First, let's nail down what exactly we mean by a positive affect. Think of the most optimistic person in your life, right? They're a ray of sunshine. The future is full of possibilities. They shake off bad experiences like a muddy dog in July, and they're confident that they can rise to any challenge. This is like the Disney character Dory from Finding Nemo. No matter how bad things get, she just keeps saying, "Hey there, Mr. Grumpy Gills. What do we do when life gets us down? Just keep swimming, just keep swimming, just keep swimming, swimming, swimming. What do? We swim, swim." Almost nothing can get her down. On the other hand, a person with a negative affect would be the opposite. They're gloomy, pessimistic, angry, and they often respond to new challenges with fear. Think of Eeyore from Winnie the Pooh. He basically sees the whole world through shit-colored glasses, and subsequently, everything sucks for him. Even when it doesn't have to. Now, quick note, I want to acknowledge that Eeyore might have his own mental health struggles, so I'm not suggesting that you can just magically snap your finger and clinical depression is just gonna vanish, right? You can't just choose to feel good in that situation. You need professional help, and this example is just to show the impact of how, if you do have those struggles, that can impede on your recovery from injury, on your experience of pain, and etc. It's just trying to show that being physically healthy isn't the whole picture when it comes to pain. Hey, real quick, comment below and tell us if you think that a positive attitude actually makes a difference for your health and for pain. Okay, so if Eeyore and Dory both had chronic pain, I know, not the most exciting concept for the new Finding Nemo 3 or Winnie the Pooh reboot, but roll with me here. How would their affectivity, their attitudes, impact their recovery? Well, negative emotional responses have been shown to intensify the experience of pain. This can be helpful in acute pain since it helps prevent further injury, and it's good to be a little bit afraid of, sticking your hand in a hot flame, because that's stupid. But if negative affectivity persists, then the predicted outcomes are poor. For example, fear of pain is going to lead Eeyore to avoid activities that he thinks are going to be painful. And this pattern has been shown to predate future depressive feelings and pain disability. In contrast, positive affect has been shown to diminish chronic pain, for example, in females with osteoarthritis and/or fibromyalgia. A more positive outlook on life has also been shown to buffer the negative effects of pain on general functioning and well-being in patients with rheumatoid arthritis, chronic back pain, chronic knee pain, and other conditions. So a positive attitude actually helped them feel and function better. But how could that be? Proposed physiological mechanisms for the previously mentioned benefits of positive affect include lowering cortisol, reducing inflammation, and changing how the central nervous system responds to signals from damaged tissues. Psychological reasons for improved pain management include counteracting the fear avoidance pattern we discussed earlier, reducing pain catastrophizing, and decreasing rumination, and frankly, just getting people out of their own heads. So, if your doctor tells you that having a positive attitude is going to help your chronic pain go away, are they giving you good advice or just spouting nonsense? Are they trying to help, or are they just ignoring your pain because they were too dumb to figure out what's really going on? Is it health or hoax? We're going to rate this one as health. On a scale of health to hoax, being represented by an apple for health and a snake for hoax, we would give this one about half an apple. It works, but you still need to address the underlying issues, if any are present. So it turns out that adopting a positive attitude to improve your chronic pain is in fact a good recommendation for your health. This may be especially true if you naturally tend to have a more negative outlook on your own health. That can be great news, but changing your outlook on life is not easy. And oftentimes it's just not possible without professional help. So our main study in review today recommends that you seek out a physician who is licensed to perform positive psychology interventions. We do want to acknowledge that although attitude is indeed a critical component to overcoming pain, it isn't necessarily always the only component, and that the idea of simply toughing it out without professional advice is not necessarily going to work for every person and every condition, right? Your situation is yours alone, and this isn't medical advice, so you always want to ask your doctor about pain, since even though mindset can improve your experience, it might not solve everything, and pain can still be related to an underlying problem sometimes, and you're going to want to know if and when that's the case. Thank you for joining us on this week's episode. Please comment below, tell us if you've had an experience where your mindset shifted your recovery, and subscribe to our channel so you get notifications of when we release future episodes. Thanks again, and we'll see you next time on Health or Hoax.